Well, good morning to you all, and happy World Delirium Awareness Day. I guess that's how you say it. um, my name is Stefan Kreisel. I'm head of the Division of Geriatric Psychiatry at the Evangelisches Klinikum Bethel in Bielefeld, Germany, a mid-sized town you're zooming into as you're listening to my words in the middle of Germany. I wanted to share with you our details on our long-running delirium prevention program, which we set up at our hospital 2012. And it's been ongoing more or less with the same team ever since. What we do is that we take care of patients in the departments of our internal medicine colleagues, of our orthopedics colleagues, of our neurological colleagues at our main hospital, apart from the psychiatric department where I'm located at. And we serve several wards. We screen patients on admission. We screen patients on admission in respect to cognitive deficits, geriatric assessment, more or less features of vulnerability. And if they are deemed to be at risk for delirium, they're included in our delirium prevention program. And our delirium prevention program is more or less based on a non-pharmacological approach, first championed, or at least very prominently championed by the HELP program of Sharon Inouye. That was our chaperone, if you like, when we started out many years ago. It's been adapted to our local setting. We have to take into consideration the necessities of the way hospitals work in the German setting. And clearly, we've also placed our own sort of focus on what we think is important in respect to delirium prevention. Now, you can picture our intervention, our prevention, as a sort of menu. So when patients are included into the program, their risk factors, their individual vulnerabilities are taken into account, and then they are presented with certain features of a preventive menu. The main course of this menu is clearly an attempt to interact with the patients during their somatic hospital stay. We do what has been shown to be best practice. So there's an interaction to reorient, to activate, to communicate with these patients in a way that helps them stay alert and attentive. And this is performed, and that's basically the core of everything we do. This is performed by usually young personnel, which we recruit from a program that's been in existence in the German setting for many years. It's basically a social year, if you like. Back many years ago, the male portion of the population had to either go to the army or they could do a year of social work. And ever since mandatory military service has been taken off the agenda, the idea of a year of, in this case, no longer mandatory, but possible social work and social engagement has been retained. So there's a tradition in the German system that after school is out and before further training or university, the young folk can do a year of social work, and they can choose where they want to do it. And those that decide to do it with us, they are trained, they are acquainted with the features of delirium and interaction with the elderly and the vulnerable, And once that's in place, they basically do the preventive work in the way that I just set out as the main course. And this program, as set out, as I said, has been around for almost a decade. And we think it's been very successful. As you can see on the slide, which is up just now, we've looked at the incidence of delirium in the hospital setting. Clearly, we also have quite a few patients who are admitted with features of delirium, but those that actually develop delirium in hospital and are part of the program, we've kept track of that over the many years, and I think it's quite clear that the in-hospital incidence of delirium of those patients that are receiving the program has almost linearly decreased over the past years, and is now in a range that is probably no longer immutable. You can't get much better than 1 to 2%. Now, the main problem associated with such a prevention program, I mean, if you've seen these figures, you clearly would like to have a program like this, I suspect, in your setting. But there's a downside to it. Now, volunteers are not for free, but setting up and coordinating the program in a large hospital, as we are, is going to cost something. You need personnel to do the coordinating, to do the education, to do the professional screening, to take care of liaison questions that are necessary, and the money needed to do this is not available in the system. So there's no mandatory or pre-programmed reimbursement for the job that we do. And so we've been able to keep this program running because of our parent organization, the von Bodelschwingsche Stiftung Bethel, who have generously funded us over these many years and kept the program on track. And that's not possible everywhere. So now that I've done the formal introduction, the more important part of our contribution to the World Delirium Awareness Day is that those that actually do the work, that do the preventing work, that do the coordinating work, at least a small portion of those involved will be introducing themselves in the next video sequence. And thereafter, you'll see in German a short video segment that we've pre-produced for educational purposes that demonstrates one of these menu programs. So enjoy that. I hope you'll remain hungry for the field of delirium, irrespective of any menu that I've talked about. And I guess we'll see each other next year. So bye-bye from Bielefeld.
Hallo, wir sind das Help-Team am Evangelischen Klinikum Bethel. Wir sind ein Delir-Präventionsprogramm und bieten unterschiedliche Interventionen zur Delir-Prävention an. Unter anderem screenen wir die Patienten jeden Tag mittels des 4 ATs. Wir leisten Gesellschaft und bringen Zeit mit.
Wir unterstützen bei der Mahlzeit und fördern die Konzentration.
Wir bieten Orientierung und bringen ein Stück Alltag.
Wir bieten Aktivierung und Gedächtnistraining.
Ziele des Plusbesuchs. Patient ist orientiert. Patient trägt Brille und Hörgeräte. Patient hat notwendige Dinge in Reichweite, zum Beispiel Getränk, Notruf, persönliche Dinge. Patient fühlt sich wohl und unterstützt.
Guten Morgen, Frau Müller.
Guten Morgen.
Wie geht's Ihnen denn?
Gut.
Das ist schön, das freut mich. Haben Sie denn auch gut geschlafen?
Ach ja, letzte Nacht war ganz gut. Da
Ja,
war ein anderes Mädchen in Lila, die hat mir so, ja, sie hatte so ein T-Shirt wie sie an, die hat mir so einen Tee gebracht und hat mir ein Märchen vorgelesen und dann bin ich ganz gut eingeschlafen, doch, muss ich sagen.
Das freut mich für Sie.
Ja.
Ich habe ein paar Spiele mitgebracht. Ich fände es gut, wenn wir etwas Aktives heute machen würden.
Was Aktives? Spiele?
Genau. Ich habe zum Beispiel Mensch, ärger dich nicht mit. Aber ich sehe gerade, Sie haben Ihre Brille gar nicht aufgesetzt. Ich gebe Ihnen die mal.
Ach, ja, meinen Sie?
Ja, sonst sehen Sie doch gar nicht so gut.
Naja, da haben Sie recht.
Das stimmt. Ich mache Ihnen die auch noch schnell sauber.
Ach, das ist aber lieb. Das ist ein Service hier.
So, bitteschön, Frau Müller.
Ja, ja, in der Tat. Ja.
Gleich viel besser, oder?
Ja, danke schön.
Das freut mich. Ich schreibe Ihnen mal das Datum von heute an.
Ja?
Genau.
Och. Das Datum von heute?
Heute ist nämlich schon Mittwoch, der
Ja.
9. November.
Ach so, weit sind wir schon?
Genau.
Ich dachte, wir haben noch Oktober. Guck einer an.
Nee, wir sind schon im November angelangt.
Ah, man wird hier doof hier.
Wenn Sie nach draußen schauen, sehen Sie sogar, dass es schon das erste Mal geschneit hat.
Tatsächlich. Das ist aber ein Wetter.
Genau. Und in einem Monat kommt sogar schon der Nikolaus wieder vor Ihre Tür.
Mal die Zeit vergeht, ne?
Ganz fix, das sage ich Ihnen.
Ja. Mittwoch, der 2. November 2016. Die Zeit vergeht, sag ich Ihnen.
Der 9. November, Frau Müller, nicht der 2.
Ach ja, stimmt, der 9. November.
Genau.
Ja, ja, schön, dass Sie das drauf geschrieben haben. Da muss ich mal öfters drauf gucken,
Genau.
weil das vergesse ich so schnell.
Das ist manchmal so, wenn man ein paar Tage hier im Krankenhaus liegt.
Ja, da haben Sie recht. Ich hoffe, dass ich heute rauskomme.
Viele ältere Patienten denken nicht daran, ausreichend zu trinken. Erinnere sie freundlich daran. Patienten sollen über das Datum informiert werden. Sie sollen sich nicht belehrt fühlen. Setz dich auf einen Hocker an das Patientenbett. Auf Augenhöhe sein erleichtert die Kommunikation. Kleine Dinge, die du für den Patienten tun kannst, damit er sich wohlfühlt. Lüften, Heizung verstellen, Kopfkissen aufschütteln, Nachttisch aufräumen, Brille putzen, Blumenwasser wechseln, Anruf bei Angehörigen ermöglichen, Kopfteil des Bettes verändern, zusätzliches Kopfkissen oder eine Decke anbieten, Händewaschen ermöglichen, warmes Getränk anbieten, Waren aus dem Kiosk besorgen.